around 24 confirmed cases of the Omicron variant across at least 10 states. And the Delta variant still is not slowing down. Margaret Brennan, moderator of Face the Nation, joins us from Washington tonight, as she does most Fridays. Margaret, you're speaking with the Surgeon General this weekend. What will you ask him about the strategy the Biden administration rolled out this week?
We want to know from the Surgeon General exactly what the timeline is for getting clear answers on the questions regarding this new variant, Omicron, and whether we need to look at developing new tools or whether the existing toolbox works. The White House says they hope it does. They are encouraging people to go get your booster shot, and if you haven't gotten your vaccination, to go out and get it now, because they believe, well, actually they know, it does protect against the Delta variant, which is the variant that is infecting and hitting the Midwest and the East Coast of this country hard. So it won't make you completely immune, but it will lessen your symptoms if you get infected. The question is, does Omicron become the exception? Is there something so unique to these mutations that makes it even more of a risk? So we will ask the Surgeon General about that and about explaining some of these policies that the president announced, including his request to the CDC to issue new guidelines that would allow students to stay in the classroom even if they are exposed to COVID-19.
You're also speaking with a top scientist with the World Health Organization. It's been a week since this new variant was first made public by South African scientists, 6 days since the World Health Organization declared this strain a variant of concern. We've seen so many developments since. What are you learning?
Well, South African scientists are on the cutting edge of this. They discovered it, they've sequenced it, they shared it with the World Health Organization, and they did so within 36 hours of their first discovery. We want to know what the World Health Organization is learning from scientists around the world who are now all trying to figure out what the mutations in this variant mean in terms of their ability to pierce the protections of vaccines, to challenge some of the existing treatments, and whether new tools need to be developed. You've heard from vaccine makers not to panic, that they do think they can kind of reboot the vaccines that exist to add in this sort of protection against this mutation. But what you also hear from the World Health Organization is we will continue to see these new variants until the world is vaccinated. And we will talk about vaccine equity, getting shots into the arms of those in developing countries and poor countries, or in countries where the government's just unable to perform the task of getting the vaccine to its constituents.
Which is also very important to reach, right? That herd immunity status. Margaret, we'll see you Sunday. Thank you. You can see Face the Nation Sunday at 10:30 on WBZ. Lisa? Well,